All right, so chapter 15 is going to be about infection control and the dental radiographer. We're going to talk specifically about how we can control the spread of infection when we are taking radiographs. A lot of this information should not be new to you because I know you're also learning these things in preclinic, but we're going to go over them anyway. By the end of this chapter, you should be able to define the key terms associated with infection control, describe the rationale for infection control, describe the three possible routes of disease transmission, describe the conditions that must be present for disease transmission to occur, discuss personal protective equipment, hand hygiene, sterilization, and disinfection of instruments, and the cleaning and disinfection of the dental unit and environmental surfaces. You should be able to describe the infection control procedures that are necessary before X-ray exposure, during X-ray exposure, after X-ray exposure, describe the infection control procedures that are necessary for digital imaging, and describe the infection control procedures that are necessary for film processing. You're going to discuss film handling in the darkroom, both with and without barrier envelopes. And then we're going to discuss film handling without barrier envelopes using the daylight loader of an automatic processor. Okay, so what are we doing this for? Dental professionals are at an increased risk for acquiring diseases in this setting because we are exposed not only to blood and bloodborne pathogens, but we're also exposed to saliva and aerosols, respiratory infections. And so dental professionals are at an increased risk for these kinds of things. And it means that we need to be even more careful in our practice in order to prevent the spread of infection. Infectious diseases present that significant hazard in the dental environment because of those conditions. And so infection control protocols, are used in dentistry to minimize the potential for disease transmission. We have a lot of different infection control protocols that we use. A lot of the things that you will be reading about and we're going to be talking about here are before COVID-19 set in. And so also, I need you to keep in mind that everything that is presented to you in your book was written in 2016. So a lot of the references and the research that they did were before 2016. And so sometimes you'll see references from, 2012 and things like that. And so what we need to keep in mind when we're reading these infection control protocols is that things change very quickly when it comes to infection control. Things don't change in dentistry very quickly, but when it comes to infection control, things from the CDC, uh, things change. And so the purpose here, we're going to present the rationale for infection control and why it's important. We're going to review those guidelines from the CDC, and we're going to describe in detail the step-by-step infection control procedures that we need to know in order to go about taking radiographs. Okay, so the first things we need to understand is why are we controlling for infection? Like, why are we doing these things? The rationale for these infection controls, and we need to go over infection control terminology. These are all things you probably already learned in preclinic, but we're going to go over them anyway. So, in order to understand that infection control practices, the dental professional must first understand the purpose and the terminology that's frequently used in these control protocols. Okay, so why do we do this? We're doing it to prevent the transmission of infectious diseases. And there's three separate ways that diseases are transmitted in a dental office. The first one is from the patient to us. They can give us infectious diseases. The next one is from the dental professional to the patient, right? We don't want to make them sick. And then the other one is from patient to patient, and we'll go over how patient to patient transmission happens. The use of the recommended infection control guidelines can greatly reduce the transmission of all three of these. Okay, so the first term we really need to go over is what a pathogen is, right? What it is we're protecting ourselves from. So a pathogen is a microorganism, which means it's microscopic, which means you can't see it with the naked eye, and it is capable of causing disease. So it's not just an atom or a molecule or anything else that's invisible and too small for us to see. It is, well, I guess atoms aren't really invisible, but anyway, um, it is not only microscopic that we can't see it, but it's capable of causing disease. Dental patients and professionals are exposed to a variety of pathogens that are present in the oral and respiratory secretions. Those pathogens include cold and flu viruses, the cytomegalovirus, the hepatitis B virus, the hepatitis C virus, the herpes simplex 1, herpes simplex 2, human immunodeficiency virus, and the Mycobacterium tuberculosis, which is a respiratory disease. Also, now with COVID, we are exposed to the COVID-19 or the new coronavirus. All right, and there are a couple of different ways that we are exposed to these different pathogens. There's direct and indirect. So we have direct contact with pathogens that are present in saliva, blood, respiratory secretions, or lesions, right? We touch our patient's blood and we are in direct contact with them, right? We are also in direct contact with their airborne contaminants that are present in the splatter or aerosols of oral and respiratory fluids. So anytime we're creating aerosols, anytime they're breathing on us, we're in direct contact with those airborne contaminants. Then we have indirect contact, which is anytime we touch a contaminated object or instrument. So basically, the pathogen has gone from the patient to the object and then from the object to us. It's not direct. We're not touching the patient specifically in the way that, that contact, that direct contact. Okay, so then here we're going to go over the route of transmission. All three of these conditions have to be present in order for that disease to be transmitted. So the first one is there has to be a susceptible host, basically a human in this case, in all of the ways that we're talking about it. So either our patient or us. We are susceptible. It means that the pathogen, whatever it is, can make us sick. Well, no, it means we can get sick by the pathogen, not that the pathogen can make us sick. The next one is the pathogen has a sufficient infectivity and number to cause infection. And so, in this way, the pathogen has to be able to make us sick. So, it has to be a strong enough virus or bacteria in order for it to hurt our immune system and overcome our immune system in order to make us sick. And then the next one is the portal through which the pathogen enters the host. So if, it doesn't enter through our mucous membranes of some kind, like in our eyes, our respiratory system, a break in our skin. Your skin is actually the largest organ in your body, and it is one of the most important organs of your systems because it protects you from all of those bacteria and hosts. And so, if you get someone's blood on your skin, you're a lot less likely to get sick than you are if the blood were to spatter into your eye, kind of thing. And so, the portal with which the pathogen enters is really important. All three of these things have to happen in order for you to get sick. And so if there is one, you're not a susceptible host, maybe it means your immune system is fantastic and you just don't get sick by these kinds of things. Maybe you already had a vaccine, right? And so you're not susceptible to the flu. And so if you're exposed to the flu, you don't get sick from it. That means that you're not a susceptible host. Then, the pathogen isn't sufficient infectivity and it's not in enough numbers to cause infection. This is probably the number one thing that was really not understood when it comes to HIV because HIV doesn't live very long on surfaces. And so you might be exposed to someone's blood on the surface, but it's possible that enough of that virus has already died before you're exposed to it. And so you don't get sick from it because your immune system is able to kill it very easily. And so if there's not either the virus isn't strong enough or there isn't enough of the virus in order to make you sick, in order to overcome your immune system. And then the next one is the portal through which the pathogen enters. So if you're wearing all of your personal protective equipment, your PPE, and you're protected in that way, your skin is covered, your fingers are covered, your face is covered, you're not breathing in anyone's aerosols, you're wearing goggles, so the blood might spatter on your face, but it's not going to get into your eyes because you're wearing that personal protective equipment. And so we put in things in place, you staying healthy, you getting vaccines, those kinds of things will stop the spread from the host. Making sure we're doing all of our proper care when it comes to cleaning and things like that. That's going to prevent the pathogen being in sufficient numbers. And then the portal, we're going to wear all of our protective equipment, and so they can't enter into our system. And so all three of these things are really important. All right, so I want you to read all of these definitions from 136. I'm going to read them out loud to you as well, so there is no confusion when it comes to what each of these terms mean. So there's antiseptic, which is a substance that inhibits the growth of bacteria. This term is often used to describe hand washing or wound cleansing procedures. There is asepsis, which is the absence of pathogens or disease-causing microorganisms. This term is used to describe procedures that prevent infection, like aseptic techniques. Bloodborne pathogens, which are pathogens that are present in your blood that cause disease in human. Then we have disinfect, which is a chemical or physical procedure to inhibit or destroy pathogens. We'll get into disinfections later, but disinfection does not kill highly resistant bacteria or fungal spores. Then we have disinfection, which is the process or the act of disinfecting. Then we have exposure incident, which is a specific incident that involves contact with blood or other potentially infectious materials that result from procedures performed by the dental professional. Okay, and we're going to keep going. These are on page 136. So the next one is infectious waste, which is waste that consists of blood, blood products, contaminated sharps, or other microbiologic products. Occupational exposure is the contact with blood or other infectious materials that involve the skin, eye, or mucous membranes that results from procedures performed by the dental professional. So occupational exposure is slightly different from exposure incident. Make sure you know the difference. Parental exposure Parenteral exposure is the exposure to blood or other infectious materials that results from piercing or puncturing the skin barrier, like a needle stick injury is a parenteral exposure. PPE, personal protective equipment, is anything that you put on your body that protects you from other things. So it's personal. It means I'm wearing it. It's protective attire, which includes gloves, mask, eyewear, face shield, gown, things like that. Sharps are any objects that penetrate the skin, including but not limited to needles and scalpels. In dental hygiene, it's every single one of your instruments. Every single one of them will do this, except maybe your mirror, unless you're being really rough. Standard precautions are measures that include a standard of care designed to protect healthcare personnel and patients from pathogens that can be spread by blood or other body secretions, fluids, or excretions. Then we have sterilize, which is the use of physical or chemical procedures to destroy all pathogens, which include highly resistant bacteria and those fungal spores. So there's a very, very big difference between the word sterilize and disinfect. Okay, you need to know that. You need to know the difference between disinfect and sterilize. And then sterilization is the act of sterilizing. There are two separate types of sterilizing that are used most often in dental kinds of things, and one of them is the autoclave, which is a heat sterilization machine. You put it in bags, it sterilizes through heat, it kills all of those spores. There's all of those tests to make sure that the heat got up to the temperature that it was supposed to. The other one is a chemical. There are numerous amounts of chemicals that are those high level disinfectants that can, with the right amount of time, actually sterilize the things that are in them. Okay, so if you go to box 15-1, you'll see that those infection control practices in the dental healthcare setting, those go over some of all of the different types of practices that we use. The big ones will be the personal protective equipment, hand hygiene, sterilization and disinfection of instruments and surfaces, and then cleaning and disinfection of dental unit and environmental surfaces. And we're going to go into each one of these a little bit more. What I want you to know is that the CDC, the Center for Disease and Control and Prevention, was the governing body that not only develops the infection control procedures, but also will enforce those regulations. All right, so first up is personal protective equipment, or PPE. These include your protective clothing, like your scrubs first, Scrubs are made out of a material that is easy to clean, and bacteria doesn't adhere quite as easily to scrub material as it does to maybe like a sweater made out of wool, right? The other one is going to be the gown that you wear. Offices will have you either wear a disposable gown that you change after every patient, or they'll have you wear like a lab coat of some kind that they do on-site laundering for. The other one is going to be gloves. We all know about gloves. These actually came out in the 1980s, and so you'll see some dentists, some professionals are still out there that have been around since before the mid 80s, and they actually practiced without gloves before that. And so this is one of those things that you'll hear of people who practice without gloves. And then the other one is masks and protective eyewear. So right now with COVID-19, we are practicing if you're not doing a procedure with that creates aerosols, then you can wear a level 3 surgical mask. If you are doing a procedure that creates aerosols, then you have to wear an N95. That is per the Texas State Board mandates since COVID-19 has come out. Your book, it'll talk about how you don't, because there's no aerosols created in dental radiographs, that you don't have to wear the mask and glasses, but completely ignore that. And so right now with COVID, we do wear a mask and glasses. And I mean, just all the time, even if it's not required, just wear your mask and glasses when you do that because they breathe on you, and you don't necessarily want to be exposed to that. And so those are the mandates. Also, because of COVID, we do have to wear a face shield. Now, the face shield does not make up for the eyewear. And so you have to wear either your glasses, you have to wear, if you're wearing a face shield, you don't have to have those side protectors with your glasses, but you do have to be wearing glasses. And then you have to wear either goggles or loops. And so you must wear something underneath your face shield. All right, hand hygiene. I'm very excited about hand hygiene being more common now that COVID-19 has come around because I think it's going to really reduce cold and flu seasons. But anyway, um, you must perform hand hygiene before and after treating your patients. So before you put on gloves and after you take those gloves off, after removing gloves that are torn, cut, or punctured, before putting on new gloves. So if you are doing something and you accidentally rip your glove, then you do have to take it off, wash your hands, put on new gloves. After contact of bare hands with inanimate objects likely to be contained by blood, saliva, or respiratory secretions, don't touch those things. But anyway, wash your hands. And then before leaving your dental operatory, so every time you're going to go, get your dentist in order to come in for your exam, you're going to need to go wash your hands first. Anytime your hands are visibly soiled or contaminated, when they're visibly soiled or contaminated, you need to wash your hands, not use hand sanitizer. Um, the book goes into the differences between the routine hand wash, the antiseptic hand wash, and the antiseptic hand rub. And so a routine hand wash, the only difference between that one and the antiseptic hand wash is the type of soap that you use. And so with a routine one, you are going to use a non-antimicrobial soap, just regular soap, for 40 to 60 seconds. You'll sing your ABCs twice. And then with an antiseptic hand wash, you're going to use an antimicrobial soap. So something like chlorhexidine, iodine, iodophores. Your book also says triclosan, although triclosan has since been banned. So that's not going to be a thing anymore. And then the antiseptic hand rub, which is hand sanitizer. This one is an alcohol-based product. You basically rub it onto your hands until your hands are dry. So at no point when you're using hand sanitizer should you need to get a napkin to dry your hands, right? You want to let them air dry. Care of your hands is important in the dental community. You are now working with your hands. You stick your hands in people's mouths, okay? And so it is really important that you take care of your hands. Your book says this really, it's kind of embarrassing. It says dental professionals with exudative or weeping lesions on their hands have to refrain from direct contact. Yes, please. If you have a weeping sore on your hand, don't touch anyone with your bare hand. That's just good. That's just good advice there. The other thing too is that if you have a cut on your hand, it now means that or a scratch of some kind, if it bleeds, then that means that your skin is not intact, and you could very easily get an infection on that spot, and it could expose you to those it can expose your blood to other people's pathogens. And so if you have a cut on your hand, I'm sure you guys went over this with preclinic, but you need to use a band-aid of some kind before you put on gloves. I know that can be kind of annoying to wear a band-aid, and you do have to change those out when you wash your hands, but it's really important in order to protect your hand. There is such a thing as, it's called herpetic whitlow, and it's when the herpes virus is exposed to a cut on your finger, and you can actually get herpetic lesions on your fingers. So when we say to do all of these things, they might seem annoying, but we are actually trying to protect you from having really disgusting things on your hands. All right, so the sterilization and disinfection of instruments. This is important because the level that the instrument is used in is going to determine the type of either sterilization or disinfection. This could very well be on your boards. I think I actually remember seeing this one on my board. And so these are very important terms when we're talking about infection control. So there is critical instruments, which are instruments that penetrate soft tissue or bone. They are critical, and they must be sterilized in between use. They include forceps, scalpels, bone chisels, scalers, curettes are all of our instruments that we put inside people's mouths, except for our mirror, are considered critical. The other one is semi-critical, which are things that touch the soft tissue, but they do not penetrate that soft tissue. Man, I say the word penetrate so many times more than I really should. And so our mirror is a semi-critical instrument. All of our beam alignment devices and our film holders, those are all semi-critical because they go inside someone's mouth and they touch that soft tissue. Non-critical instruments are things that don't come in contact with those mucous membranes. And so things like our tray on our thing, those don't come in contact with the actual tissue. The counters that we use, and things like that, those don't come in contact with the mucous membrane. All right, so just like I said, those different types of instruments, critical, semi-critical, non-critical, those all have different levels of disinfection or sterilization that we must do in order to keep them clean. And so we have intermediate level, we have low level disinfectants, and we have high level disinfectants. A low level disinfectant is something like a Clorox wipe. A intermediate level is something that you'll see sometimes, although it's not typically used. And then a high level disinfectant is a disinfection. It's a chemical that can be used to disinfect heat-sensitive, semi-critical dental instruments. So some offices will use this. Sometimes it's referred to as cold sterile. There are more than one kind of type of chemical that can be used in order to sterilize those heat sensitive things. Sometimes, especially with dental radiology, the beam alignment devices or the film holders that you use, they are semi-critical, and so they do need to be sterilized in between uses. And so sometimes they are not safe to put into the autoclave, and the office that I worked at used a kind like that, and so they needed to go into a cold sterile. It's very important that items that go into the cold sterile stay in the cold sterile for as long as it takes. Different chemicals require different amounts. Typically, it's anywhere between 12 to 24 hours. That's kind of like the norm. And so those items have to stay in the cold sterile for that amount of time before they're considered sterile. And if you take them out before the amount of time, let's just say it, they're not sterile. Then we have low level disinfectants, which are, things like things you use to keep the floor clean, like, Pledge, things like that. Those are low level disinfectants, and they are used for cleaning floors and walls and things like that. Typically, in most offices, there is a housekeeping service that they, purchase, and so they come in. Sometimes they'll take out the trash for you, they'll sweep the floors, they'll mop the floors, things like that. They're going to do a lot of that low level disinfectants. Some offices you work in, though, they won't have that, and so you'll be the one taking out the garbage and sweeping the floor, and that's okay. I I just want to say I've temped in an office where I went in the morning and they gave me a RIN instrument, and I had one morning, I took x-rays on one person in the morning, and then when I went back and I was like, hey, where do I find the other RIN instruments? They were like, oh no, you use that same one. You just wipe it down. And I was like, what? And they're, yeah, we just wipe that down. And I'm like, no, mm, things that go inside someone's mouth are semi-critical. They need to be sterilized in between. And then they let me know that they only put them in the cold sterile overnight. And then during the day, in between patients, they just wipe them down. That was the only time I ever walked out on an office and didn't finish the day, because it would be on my license if I were purposefully, negligently, knowing that I was not properly cleaning the things between patients. And so it would be, I'm surprised that the office is still around. And I don't know if they've changed. I'm hoping that maybe my walking out helped them to understand that what they were doing was not appropriate. It is important that you like report them. I didn't do that. I did report the fact to the temp agency. I'm hoping they report it. I don't know, but that's just something I want you to keep in mind, that the instruments that we use in radiology, the things that go inside the patient's mouth, not the sensors, those are semi-critical instruments. They need to be sterilized. So next we're going to get into the infection control procedures. So we're going to do before, during, after exposure, and then for processing. Also, before we get on these kinds of things, I need to point out that we use standard precautions and universal precautions. I know you guys are learning the difference between those two, but so standard precautions are the precautions that we do for everyone. They are the same for every single person. And we do this because of universal precautions. And universal precautions mean that we treat every single person like they're sick with everything, okay? They all have HIV. They all have hepatitis. They all have herpes. Okay. And we just pretend that they all have it, and we treat every single person the same by following the standard precautions. And so if you know a patient comes in and they write on their medical history that they have HIV, you're still going to do the same things, the same exact procedures with them that you'll do with every other person who walks in that door, because either those other people are lying about the fact that they have HIV, or they don't know that they have HIV, or they don't have HIV and we just don't want to give it to them. So I just want you to all to know that everything that we talk about here stays the same for every single patient, okay? No matter what. It is inappropriate for us to treat any one of our patients differently based on something that they have disclosed to us. Okay, so before procedures, we want to prepare our x-ray machine, right? We would turn it on. And then we're going to prepare our dental chair. We're going to place barriers on our chair. We're going to prepare our work area. So we're going to have our computer on. We're going to have barriers on our computer. We're going to have the patient's chart brought up on there, and we're going to be clicking on the patient's chart. We'll find the patient we want, and then we will open up the x-ray stuff in that. And then the next one is going to be, we're going to get our lead apron ready. Sometimes offices keep it in a different place, and so you'd have to go and get it. I know sometimes they'll keep it in like a cabinet where they have the tube head kind of stored away. Here at ours, it's right there, so you really don't have to like get it ready, but it's there. The next one is we want to have all of our stuff ready to take x-rays on them. So we want to have our film ready if we're using film. If we're using the photostimulable phosphor sensors, our PSP plates, we want to have our digital sensors ready. We want to have our beam alignment devices out. So it would be inappropriate for you to seat your patient and then walk into sterilization to get your packet, right? So I want you to have your beam alignment devices out on the counter. Also, the miscellaneous items here refer to our patient's items. And so that means, any kind of nose rings or tongue rings or jewelry um, of any kind, from the collarbone up. Okay, let's just make that definition. And then I was trying to take an x-ray on a patient once, a panoramic, and I told him that he needed to remove any jewelry from the neck up. And he started taking off his belt for me because he thought that the metal on the belt was, and I that was a little awkward. I was like, whoa, whoa, whoa. He was like, wait, there's metal on my belt. I'm like, yeah, this isn't an MRI. Like this is just from the collarbone up. And If they have any bobby pins or things like that in their hair, they have to take that out for the piano, but not for intraoral x-rays. Anyway, if they have like their purse that's in the way of you being able to walk around the patient, that's going to be something that they need to move. You know, if they're wearing a really bulky coat and you're not able to put the lead apron on over that, they need to take that off. And so you just let your patient know exactly what kind of x-ray we're going to be taking, and you kind of prep them ahead of time so that they can be ready to take those radiographs. You want all of these things ready before you seat your patient in the chair. So, like when they're in your operatory, you're telling them all of these things to get them ready. They're not going to bring their coat, they're not going to bring their purse, they're going to take out their earrings, things like that. And then once they come and sit down, they should have everything ready. You have all of your stuff already out. One, to prevent infection control, right? You're not going to start taking radiographs and then be like, oh, yeah, I need to, go get this item. That's not how you do it, because then you have to, completely undo all of your stuff in order to be clean and then go get it and then come back and then put all that stuff back on. That's a waste. And it's a waste of time. It's a waste of items. It's also going to potentially spread infection. And then the other thing is that having everything ready for your patient ahead of time is going to save you and them time. And we want to make this as smooth a process as we possibly can. Okay, so again, preparation of the patient, the chair adjustment, headrest adjustment, lead apron, miscellaneous objects. We want to have all of our ducks in a row before we bring our patient in. Chair adjustment isn't necessarily something that you might adjust before the patient sits down, because you don't know maybe how tall that person is until they sit in that chair. That's why that little part of the chair where you step on it and you kind of like pump the chair up taller, that is something that you do once the patient is seated, and it's something that you do with your foot. You would never like reach down and touch it with your hand. I know that makes sense. No one's going to do that, but just in case, just in case. That's something that you do with your foot. That's never something that you would touch with your gloves. And then turning the chair as well. You're never going to want to, turn the chair in order to swivel and turn the patient maybe towards you or away from you. You're not going to want to do that by touching anything that's not barriered. So once your gloves are on, you're only touching barrier to barrier. The lead apron, we've talked about this when we went through the orientation, but you seat your patient down with clean hands. You pick up the lead apron, you put it on them, make sure that the thyroid collar is clasped around their neck and it's all the way up against their neck. You do not want to have a big old gaping space between where the thyroid collar and their neck is. You don't want them to be able to tuck their chin down into that thyroid collar. You want it all the way up against it so that none of that scatter radiation is going to touch your patient. Headrest adjustment, this is not really something that we would have to really worry about. But just make sure that you're only touching that lead apron with your clean hands, seat them, then you put on gloves, then you take your radiographs. And then miscellaneous objects, just let them know, like, leave all that stuff in the room. Okay, we still haven't started taking radiographs yet. So we've seated our patient, we've got everything adjusted, the lead apron's on them, they've got all their stuff in a row, and then we go over, wash our hands. You're already wearing a gown, so you'll wash your hands, you'll put on, I'm sorry, first you'll put on your mask and your eyewear, and your face shield, and then you'll wash your hands, and then you'll put on gloves. Okay, then you can prepare your beam alignment devices. Do not touch your beam alignment devices before you are all washed up, all PPE'd up, and then have on your gloves. Okay, so during exposure. Now, I'm going to talk to you a little bit both about how we would do it with sensors and how we would do this with film. Okay, so this might take a little bit longer than maybe you're hoping I'll take on these things. So anytime you take a radiograph, you'll go in, you'll place it in there, and when you bring it out, there's saliva on it, and so it's wet. Sometimes there's like a little string of drool that you kind of like gotta clean up. And so every time you take that sensor out, unless you're not doing anything with it, you're just going to stick it right back in there. You need to dry it off, and so it's important for you to have a towel over by the computer in order to kind of dry that sensor off, because you don't want that saliva to like drip on other things and you don't want to, have it just sitting out and being gross. And so you're going to dry off the sensor. For film, every time you take a film out, obviously you have to walk back over. And so with that one, I want you to have either a cavity wipe out or a paper towel that has spray disinfectant on it, and you're going to sort of like wipe off the saliva on the cavity wipe. And that way, not only is the film um, drier, it doesn't have saliva on it anymore, but we're also cleaning the film just a little bit. It's not going to sterilize it. The film is still contaminated, but we are going to kind of wipe off all of that extra with a little bit of a disinfectant, and then we're going to put it in a cup. um, the collection of exposed receptors. So, if you're using bite wing tabs or things like that, you're going to have to, keep those. You have like a little garbage container by where the computer is, and that way you're able to, keep control of those kinds of things. Beam alignment devices. So you're going to have an area where you have all of your beam alignment devices set, and that way, if you take your bite wings first and then you come over, you can easily switch out your beam alignment device maybe to the PAs that you're going to be doing. So either your posterior or your anterior, and so you're going to have all of that area set up and on a paper towel ready to go by the computer, and on a paper towel, so it's not just sitting directly on the counter. Even though the counter's clean, you're going to wipe that. Things like that. You want to minimize the interruptions during exposure. So you want to, click on the type of radiographs you're going to take. That way you're not having to individually click each of the x-rays. I'll show you how to click, that you're going to take this series, you're going to take 4 bite wings. You're just going to click on the kind that you want, and then the computer will guide you through. If you're using film, you're going to want to have your films set out exactly in the order that you're going to take them in. And so we'll go over it when we talk about taking that FMX. But if you're going to have your 4 bite wings placed out, you're going to have your PAs all laid out exactly the way that you're going to take them, so that when you come over and you look at the paper towel where all of your films are, you're able to just pick up the next and know exactly where you're going to take it. The same thing with the sensor. You're going to come over and you're going to, be pushing the button, and then you're going to know exactly which radiograph you're going to take next, because the computer is going to help guide you through those. Also, I need to say, the best way for the radiographer to minimize contamination is to touch as few surfaces as possible. So if you have everything laid out for you and you're not having to kind of make any adjustments because you already prepared everything, you're not having to go dig around in drawers to get something because you already have all your stuff, then you're going to be able to reduce that spread of infection better than someone who maybe doesn't have everything set up already. All right. It feels like the during exposure was way less than the before. But anyway, now we're done, right? We've finished taking our radiographs. Our dentist has looked at our radiographs, and they have decided that we don't need to take any retakes. We've got everything we need. For the purpose of my class, you're not going to have any retakes anyway. So I'm going to look at your radiographs, and I'm going to say, okay, you're good. Go ahead and print those out. Or who, Miss Janice or Miss Cozero is going to be there with you, and they're going to say, okay, print those out for us. And then you're going to dispose of any contaminated items. So all of your garbage, basically. I'm sorry. So first, you finish taking your radiographs, you're good. You would then take your gloves off, you'd wash your hands, you'd go in the room, you'll take the lead apron off of your patient, you'll hang it up, you'll put the thyroid collar just like I told you, and then you're going to walk your patient back to your operatory. I do not recommend telling your patient where to go and trying to like hope that they find it, because that will lead them into other people's operatories potentially, and you don't want that to happen. So walk your patient back to their operatory, and then you will come back to your radiology room, and then you will you'll have washed your hands before you walk them back, so your hands are still clean. Don't touch anything in between there. And then you will come back, you'll put on new gloves, you will take down all of the barriers in your room. And so then you'll be removing all of those contaminated items, the barriers. You're going to throw that in the garbage. You'll grab your beam alignment devices, and you will take those to sterilization and put them in the sink. You will come back. You'll take your gloves off because they're done. You'll wash your hands again. You'll put on clean gloves, and then you will disinfect all of the surfaces. So you'll be either using cavi wipes or you'll be using the spray wipe spray method. With spray wipe spray, it's important to spray first, wipe all of that down. That gets all of the blood, saliva, debris off of all of the surfaces. And then you spray again and you let it dry. You want to very lightly spray, right? You're not going to like soak all of the items. But you do lightly spray so that the disinfectant remains on the surface of the surfaces for long enough that it truly does disinfect and it does what it's supposed to do by killing, tuberculosis and things like that. What have I not said? Make sure that the lead apron is only touched with clean hands. Lightly spray things before rewrapping. So at our clinic, you would not rewrap anything. You leave it unbarriered so that the next person who comes in to take radiographs, if everything is clean and unbarriered, then they know it's clean. If there are barriers left on, right, because there were barriers left on while you were walking your patient back to their room, they know if someone were to walk in and there are barriers everywhere, they know it's contaminated. And then, for the sensors. So for film, you'll have your things in a cup and you'll leave those while you're cleaning the room. And then you'll take that film over to the daylight loader. You'll put it in there. You'll put a new cup in there. We'll talk about that in a bit. Then you'll process your films after you would have already cleaned your room, because the next person might need to use that room while you're processing films. Or you might even convince the rotator to process those films for you, which would be nice. Or, clean the room too. That'd be cool too. With a sensor, you take the barrier off and then you either spray wipe spray for the sensor and then you just put it back on there. We'll talk about that a little bit more later as well. But I want you to be aware that everything in that room, first the barriers come off, then you clean everything, and then you leave it clean. Here we go. So this is where we're going to talk about how to prevent the spread of infection with our sensors. And these are just the digital ones. And so with digital, we have either wired sensors or we have those photostimulable plates. And so the PSP sensors, those are treated a little bit differently than wired sensors. And both of those are treated very differently than film. With both of these, neither one is safe to put in an autoclave or be submerged in disinfecting solution, which is why it's very important that we properly barrier these items, because once the barrier comes off, they're just disinfected and then a new clean barrier is put over. And so the barriers themselves need to remain sterile. The barriers that we buy, and you must use the barriers that are meant for these kinds of things because they come in packages that are sterile. You wouldn't use, maybe food saran wrap or something like that on this, because that we don't have a guarantee that that item is sterile when it comes to us. Okay. The wired sensors have these little sleeves that go over them. The PSP sensors, you can see this picture. Let me circle it here. This is a PSP sensor. It's kind of like a little piece of film that uh, you can use over and over again. And it goes into this sort of like a scanner system you like feed it into, and you can get your digital images that way. It feels a lot like film because you take it inside the mouth and then you go over to the computer and you run it. But it is still a digital sensor, and so it has a reduced amount of radiation. This is the sensors that we were using at my office that I worked at for the longest time, and they're wonderful. They certainly have their drawbacks, but they're still very nice. And I know a lot of offices here in San Antonio are using these, so you need to be at least aware that they exist. If you go to an office where they use them, just let them know, that you have an idea, but you've never done it before. And so at any office, when you first start, they expect that some of their practices and some of their items are things that you would not have been exposed to before. Even if you've been working, for 10 years, I worked in certain offices, there are still things that I never had to use because the offices I worked at didn't have them. And so if I went to a new office now and they had something that I didn't know of, that would be okay. I would just say, hey, I haven't used this or I haven't been exposed to this since school because my other office didn't use it, and I need you to show me how to do it. And then they do, and then you know how, and then you're good, right? It's easy. So neither of these things can be submerged or placed in an autoclave. So they get a barrier, you remove the barrier, you clean the item, and then you put it in a new barrier, and then it is clean. You can find these kinds of things on figure 15-9. That is on page 143. Also, with these items, you take the barrier off, you wipe them, and you actually have to let them dry before you put the new barrier on them, just so we know, just so that was said. Okay, so we're going to be talking about infection control procedures for film. Now, film is obviously very different from digital. Digital is super easy. You just, take the radiograph, it pops up on the computer, you clean the sensor, you put a new barrier on it, you're done, right? For film, things are a little bit more complicated. And so we're going to be talking about how to transport your film for the purpose of our clinic, transporting film that is contaminated. You wipe it with a disinfectant sort of cloth or wet cavi wipe or whatever it is, and you place that film inside a plastic cup. That is how you transfer film. You don't touch the outside of the cup with your contaminated gloves so that you can grab the outside of the cup with your hands or with a clean glove on in order to transport it. We're going to talk about darkroom supplies, not nearly in as much detail as we did in Chapter 9. Those darkroom supplies are exactly all of the things we've already learned. The film handling with and without barrier envelopes, we're going to talk about these, although here in our clinic, we don't have film that has barrier or doesn't have barrier envelopes. We just have the ones that have the wrapping, the package. The disinfection for the dark room is pretty much the same as every other disinfection of radiographic areas. Things that we contaminate, we need to wipe, and things that we don't contaminate, we still need to wipe. And then the daylight loader procedures, I want you to keep in mind too, once we get to daylight loader procedures, that this might be a little bit differently. The book will describe it a different way than the way that we do it in clinic because we are an educational institution and the book is telling you how to do it in private practice. Okay, so um, they have commercially available barrier envelopes that are used to minimize the contamination of the dark room. You will find the picture of that on page 141. It's figure 15-4, and it shows you a picture of this little plastic sleeve that you put the film inside, and then you buy the film. It comes in this plastic sleeve, by the way. Just let me just say that. And then when you're in the room taking the radiographs, you actually will open that plastic sleeve and let the film fall into a cup. That way, when you take that piece of film into the daylight loader, you don't have to worry about the outside of the film being contaminated because we only contaminated the outside of the little plastic sleeve, right? If you look at procedure 15-1, that's on page 140, right on the opposite side of it, you can see how it talks about processing those films with those barrier envelopes and then how to process those films without the barrier envelopes. For the purpose of our clinic, I know some of you have already taken, well, all of you should have already taken, at this point, I'm recording this lecture ahead of time. You would have already taken those radiographs. We did things a little bit differently than the way that the book describes it because we didn't put this in anyone's mouth. I have a couple of other reasons why we did it the way that we did. As far as infection control, the risk of us actually being contaminated from that lead foil was actually much lower because the lead foil sits in that little cup for like forever. And so the pathogens that are in that cup are actually dead. We treat it like it's contaminated because I want you to be exposed to that. But when it comes to inside the daylight loader, I really don't want to mess around with having you drop it because then you could potentially drop it down in an area that you can't reach, and I don't want to spend all forever trying to find the film that you dropped. And so we did it a certain way. I want you to be aware of the way that you would do it. You wouldn't touch the film with your contaminated gloves in order to feed it into the processor. You would want to drop it into either a cup or onto a flat surface inside the daylight loader before you feed it in. But we did it differently. I know we did it differently. I just need you to be aware of the way that you would do it if you were using film on a real person, which I hope you work in an office that you don't have to do that. But anyway, you can find those procedures on page 140. Procedure 15-1 will tell you all about it. Okay, so the way that we should do this if we're working in private practice, you would put your all of your films, you would wipe them off, disinfect them, but they're contaminated, and so you put that cup inside the daylight loader. You're going to want another cup inside the daylight loader as well, where you put your film, or you can have like maybe a flat surface where you would drop the film onto, because you don't want to touch the film with your contaminated gloves while you're opening films. Sorry. And then you place either a cavi wipe of some kind in there. I think that it's a good idea just to have it there. That way, once you open, you can wipe everything down. And then for our purpose of this, you already have gloves on and you put a pair of gloves in there to change into. Um, but before when you're not at an educational institution, you do trust that everyone is doing the daylight loader process properly. And so you go in with bare hands, you come out with bare hands. Um, versus the way that we do it because we're a school. Sometimes students make the mistake of either going in with contaminated gloves or coming out with contaminated gloves, and because of that, I don't want any of you to be exposed. And so, for the purpose of this, you would put all of your items inside. You close the lid. You put your hands through. You put those gloves on. You open your contaminated films one at a time. You then allow the film to fall down either into a cup, or you can do it in a way where you open the film and you push the film into the processor without touching the film. That's also another option. Or you can have it fall into a flat surface. And then once you've opened all of your films, then you take off your gloves. And then if you haven't already fed them in, then you pick up those films, only touching them on the sides. This is important in those fingerprint artifacts. It's one of those reasons why we didn't do this as well, where you pick up the film, you only touch it on the sides, but the oil in your fingers can cause a fingerprint on your film. So you don't want to touch the film. And then you feed it into the machine. Once you feed in all of those unwrapped films, then you're done. Once they're all in, then you're done. Your hands are clean because you've only been touching clean film. So then you can pull your hands out. Yes, okay, so you can pull your hands out, you wash your hands, then you open the daylight loader and you remove all of your garbage. You'd put all of your lead um, sheets into some type of container because most offices do recycle those. And then you put all of your other garbage into the garbage. And then you would get out a film mount. You would label it with your patient's name and the date. And then you wait until all of your films come out and you grab them up and you mount them. Okay, so I don't want you all to get so hung up on the daylight loader and how it's done because every office will do it a little differently. If you go to an office, just refer back to your book, read about it. That's one of the best things about keeping all of your dental hygiene textbooks when you are a dental hygienist because you have them to refer back to. You can also find some of this information in your Darby or your Wilkins book, those big clinical hygienist books. Um, or you could just look them up. I mean, Google is your friend. And so if you end up in an office where you have these kinds of, where, your office is using a daylight loader and you've never opened an FMX inside a daylight loader before and you're nervous about it, look it up or ask an assistant to help you. Don't be afraid to ask questions later. Don't be afraid to ask me questions, but don't be afraid to ask questions of your office if you end up in an office doing something that you've only been barely exposed to, like you are here, because most of your exposure has been with digital, okay? If you have questions about the process that we did or the differences in the process that you might do in private practice, you can put those in the question and answer. You can put any questions about this chapter in the question and answer. And I think that's it. Send me an email if you have any issues.